The Biden administration is promising to administer 100 million doses of COVID vaccine during its first 100 days in office, an ambitious plan that would represent a significant increase in the amount of vaccine currently available to Oklahomans. Our in-depth conversation this week: is Oklahoma's response to the pandemic working? Can it be improved? And is our vaccination program on track? Here's Susan Caddo and her guests.
Well, Rich, even into 2021, COVID is still the top headline, the top concern, and we are joined by two very special guests who are here to help us make sense of all the new numbers coming in 2021. I'd like to welcome Dr. Jeffrey Gallus, Doctor of Osteopathic Medicine at Hillcrest Medical Center in Tulsa. Dr. Gallus, thank you for being with us.
Thank you for inviting me.
And I'd like to introduce Dr. Mary Clark. She's the president-elect of the Oklahoma State Medical Association. Dr. Clark, thank you as well for taking time with us today. I know you guys are so busy.
Well, we appreciate spending the time talking with you.
Well, it's an important topic to cover for all of Oklahomans. We want to spread awareness and understanding. And I just pulled off the computer last week's numbers for COVID. I'd like to read them really quickly. Just last week, January 8th to January 14th, there were 29,152 cases. That's a change, an increase of 19.4%. There were 210 deaths in 1 week in Oklahoma. This is from the State Department of Health. That's a change up of 14.8%. What are you guys seeing in the medical field? What kind of impact is this having on the healthcare industry in Oklahoma? Dr. Gallus, I'll begin with you.
Well, I can tell you, like everyone else, our hospitals are full, our emergency rooms are full, and our ICUs are full. I think on the impact on the inpatient side, we're seeing people really struggling to keep up with the workload and the stress of managing these very, very complex patients. Their length of stays are longer, they're more intensive.
Dr. Clark, what do you say to those who think this is being overblown? I have people that I know who are skeptical. They think they're just, it's a political thing. Do you have any words for them? Is this real?
It's definitely real. I really find the people who are extremely skeptical generally don't have contact with family or friends that are in the medical field as a general rule. It only takes you stepping into any emergency room or hospital ward or any hospital to understand the difference and the severity of what's going on. Outside the hospital looks somewhat normal. Inside the hospital, for most hospitals, kind of look like a war zone. Conference rooms are taken over for hospital beds. They're trying to make new hospital wards any place you can at any of our hospitals. Step into a hospital anywhere in the country and you'll probably see the same thing.
Yeah, Dr. Gallus, according to the Tulsa World, some hospitals, as Dr. Clark said, are putting patients in hallways, renovating conference rooms into ERs, converting entire wings into COVID units, limiting non-emergency procedures and surgeries, and admitting only the sickest of the sick COVID patients. Is that true?
Yeah, that's true. And, we have people who are sitting in the emergency room or sitting home that maybe normally we would put them in the hospital, but we just don't have room for them. We're transferring people outside of our region, as a matter of fact, because we just don't have beds. Now, we're starting to see a little bit of a peak in Tulsa, and it seems to be flattening out, but we really don't know what's going to happen next week or the week after. This is such an unpredictable event for us. It's just hard to know. But we've had situations where people are dying in the emergency room because we don't have a bed for them in the hospital, and that's really frustrating for all of our staff.
Dr. Clark, what kind of age ranges are we seeing that are most severely affected by COVID? Is it still kind of the elderly at this point, or is it all ages?
We are still seeing the severity of case is more likely to be higher with older population. That's not 100%, of course. The numbers, age ranges of infected are varied, of course, but the severity is still much higher the older you are. I primarily do outpatient medicine, so I am following these patients as an outpatient that survive and go home. Mm-hmm. And many of them have continued symptoms for months. I'm taking care of one woman, as we were discussing a few minutes ago, for oxygen for outpatient. She's been on oxygen now 3 months since October, and I don't see an end in sight as far as that we've kind of plateaued and have not improved for that. And she's in her 50s. So severity goes up with age, but boy, it's all across the spectrum.
Dr. Gallus, are you what kind of ages are you seeing up in Tulsa? And I do want to throw something else at you. I keep reading the term rationing of care. That's frightening.
Well, 80% of the people who die from COVID are 65 and older. So obviously the worst outcomes are with our older patients. But what I'm seeing in my office is younger people who are ill, who are at home and are trying to manage their symptoms at home. And for some of them, it can be very frightening. I think that, the symptoms of shortness of breath and persistent cough and fevers that can go on a week, 2 weeks. And some of those people who become ill, they're out of work, their family members are having to help care for them. There are a lot of impacts that go beyond death of this illness. And I think that's one of the things people have forgotten. But in terms of rationing, thus far, I think we've been doing a pretty good job of helping manage patients within our markets. But there are other parts of the country, California is a good example, where rationing is clearly happening. And we certainly don't want to reach that point within our own communities.
Let's turn to the prospect of a solution by way of these vaccines from Pfizer and Moderna. Is there enough vaccine in Oklahoma? I'm just going to cut right to the chase. I had some lead-up questions to that, but let's just get to it. From what either of you or both of you are seeing, is there enough vaccine in Oklahoma to administer it to everyone who wants the shot?
No.
I think the answer is there's not enough vaccine anywhere in the world right now. We think that in Oklahoma, about 5% of our population has had their first dose of their vaccine, but only less than 1% has received the second dose. So clearly within our state, we don't have enough vaccine. There's issues with production, there's issues with distribution, and there's issues with vaccination. There's no debate about that. Some of those things we have control over. I know the federal government has made lots of promises they've not been able to follow up on. But the challenge is that at some point in time, we will have adequate vaccine. We want to make sure that we have adequate distribution models and the ability to give those vaccines to the volume that we need.
Dr. Clark, you said no really quickly, and I want you to expand on that. Is Oklahoma getting its fair share of the vaccine?
That's a really good question. That is an answer that I don't know. Fair share is a loaded question. I think it's because of population, and they had certain percentage based on your state population. And then the state health department in Oklahoma has decided the distribution to the counties. I was very quickly said no, because we know by the people that have signed up on the portal, the desire for patients, Oklahomans, to have a vaccine is relatively good. It's a better than what I expected initially, and more people are signing up, which means you have lots of people signed up but can't get the vaccine. So that tells me we don't have enough, period.
Yeah, I've had a friend who put in that he was willing to drive 100 miles to wherever he needed to go to get the vaccine shot. He's older and he has some heart conditions. People are willing to drive, but there are people who say, I'm not taking that shot. Have you heard that? Why are people distrustful of the shot, Dr. Clark?
Boy, you could probably have a long discussion on that. There are so many multiple things out about any vaccine, much less COVID. The vaccine for COVID has been heightened because of, quote, the speed of it getting done, which in reality, we have technology to do that. The technology is not new. We do this on a yearly basis for our flu shots. So the speed is not really a big problem. I think there's a lot of mistrust and misinformation, if not outright lies, that have been circulated through the internet and some media outlets and some elected officials throughout many of the states that also fuel the mistrust.
Dr. Gallus, what kind of fears are you hearing, and what would you say to those who do have a fear or a wariness of taking this vaccine?
No, I think that, as Dr. Clark mentioned, a lot of people have had concerns about how quickly this vaccine was produced. But the fact of the matter is that no one asked how come it takes so long to make a vaccine in general. And there's lots of different reasons why that is, but it doesn't have to take years to create a vaccine. We can do this in less than a year, as we've demonstrated. What I tell my patients is that there's over 70,000 people who went through clinical trials with the two vaccines we have with absolutely fabulous results and very few adverse effects. Now, we've already distributed, 15 million doses across the United States and 40 million across the world with very few reports of bad side effects. The only things we know are things that we can manage very easily, like reactions to the vaccine and occasionally anaphylaxis, which we treat with epinephrine and we manage by observation. So I think that if people are looking for an explanation of whether these vaccines are safe, we have lots of data to support that, and we've got lots of data to say that they're effective. And actually, these are some of the most effective vaccines we've ever produced. So the hesitancy has a lot to do with misinformation.
Yeah, right. The 90+% effectiveness rate. That's better than the flu vaccine by a long shot, I've read, correct?
By a long shot. And this is the ability to keep people from getting ill and be hospitalized. If we can convert this to an illness that leads to sore throat and a runny nose and a little cough for a few days, I think we all can live with this. It's the hospitalizations and the deaths that are absolutely destroying, our healthcare system and our communities. And I think, we've proven that these vaccines can prevent that.
Dr. Gallons, I want to talk to you about herd immunity. First of all, what is that?
Herd immunity is reaching a point where if you have the infection, there are enough people around you who have been either vaccinated or have had the infection in the past that you can't spread it to the people around you. And so ultimately, the way out of this pandemic for us is to reach a threshold of herd immunity. And that may mean anywhere between 70 and 90% of our population have to be vaccinated or have been infected to reach herd immunity. Ultimately, we don't want infection to be the driver of herd immunity. What we want is vaccination to be the driver of herd immunity.
What about as this virus may evolve, variants of the virus? Is that still something that we can deal with?
Well, we're definitely seeing this virus change, and the virus is changing in a way that I think is definitely concerning for the medical world, in that the virus is becoming more contagious, meaning it takes fewer viral particles for people to actually demonstrate signs and symptoms of the illness. And if that's the case, the virus will spread faster, and the only way to combat this is really by a much more aggressive vaccination plan, because we know that these variants so far have been responsive to the current vaccines that are out there. But if this virus continues to evolve and change because it's growing in people, it's having the opportunity to change. If we can't prevent the infections, then it's going to continue to change. And so that's why a vaccination strategy is so important for us.
I want to move into education. Governor Stitt wants the schools to reopen, giving parents the option of sending their children back to school in person. The governor also stated that schools that enforce the use of masks will no longer have to quarantine potential exposures of students and teachers unless they're showing coronavirus symptoms. Dr. Clark, do you have any thoughts on those plans, those ideas?
Yes, I'm going to start with the recommendation that they don't need to quarantine. Governor Stitt and his administration have used a study out of North Carolina that was just published in the American Academy of Pediatrics Journal. Reading the study, and we've talked with the Oklahoma Academy of Pediatrics and the American Pediatrics groups, that assumption was never intended. That was never a recommendation that should be done. Taken out of context is how this has been used to cite a scientific article to say we can all get our children back into school. The authors of the article are still recommend that children should be quarantined, they should be wearing masks, we should continue to socially distance. We do not feel that children going back to school is probably the smartest thing to do. We saw a significant uptick at the beginning of last school year. We expect to see that again. The risk to the children is not as high because of the age population, but the risk to our educators and our staff at our schools become very, very high. And if you don't have a teacher in school, you have no one to teach your children if they're there or at distance learning. We are not particularly in agreement with having complete in-person learning. There's no perfect answer, but that is not what anyone has really recommended.
Well, Dr. Gallus, let me ask you, I'm going to play devil's advocate. Kids have been out of school going on a year now, off and on, and don't they need that structure? Don't they need that help? I mean, there are children suffering, falling behind, not only falling behind on their schoolwork, but suffering by not having the social exposure that is beneficial to them. So how do you weigh that in the balance, Dr. Gallus?
When children are in school is when they thrive. My wife is a school teacher and she teaches elementary school. So clearly, I've heard all those different discussions about this, but the fact of the matter is that when we have a positivity rate of 20 to 30% in our communities, there is no social gathering that is safe. Whether that's at school, whether it's the shopping market, whether it's at church, social gatherings are just a place where we spread virus. And especially in those school districts where the demographics are more challenging, older families, mixed families, lower socioeconomic, families, these kind of gatherings are devastating for these families. And we know what's happening in Hispanic and African-American populations who have been definitely hit. Our Native American populations have been much harder hit. And so in those schools with those demographics, you can't throw blanket answers out there and say, just put your kids back to school without understanding the consequences. When we get our positivity rates down to 5%, 4%, less than that, then schools are going to be safe to go back to face-to-face learning. But we've got to vaccinate. We've got to be responsible for all of the masking and the social distancing that are going to allow us to get our positivity rates down.
I want to talk about what each of you would like to see happen to really get us back to normal sooner instead of, hobbling along, get us back to running sooner. Dr. Gallus, we'll pick up with you since you last left off. What would you like to see happen in Oklahoma?
Well, I think our leadership needs to lead by example. Our governor needs to lead by example. We need our governor out there pushing vaccination, making sure that people understand the importance of vaccination, and dispelling a lot of the miscommunication out there in social media. And really by communicating to our communities how important and how safe and how effective these vaccines are. The other part of that is really pushing the resources out to communities to make sure that they're prepared for mass vaccinations. I said it in a letter to him that we need to vaccinate 50 to 100,000 Oklahomans a week to reach herd immunity by the end of this summer or the end of this year. And I don't see any evidence that we have the ability to do that right now. And the resources have to be there. And I hope that the Biden administration helps us with those resources as well.
Statewide mask ordinance. That has been a very big expectation for many of us, and especially with the State Medical Association. It's been a hard sell to our current governor's administration and with the current health department commissioner. We are all in it together. And then once we realize we're all in this together, and it's not just about me, it's not just about my partners, it's not just about my family, it's about everyone walking down the street, hopefully we'll all do a little bit better.
Dr. Clark, Dr. Gallus, I want to thank you so much for your time and your insight today. I know it's good information for me and for our viewers. Thank you both very much.